centuries, Bristol and the surrounding area has been creating ideas and inventions that have changed history. It's been home to world-leading scientists and engineers, environmentalists and filmmakers. And some of the inventions set to shape our futures are being created right here in Bristol. Every second of every day, somebody's working on an idea that could change our lives. As the day begins, medical researchers are dealing with matters of life and death. It's early morning in St Michael's Hospital, and some of the newly born babies in the maternity ward are waking for their first feed. The parents here watch their new babies' every breath. Peter Fleming is Professor of Infant Health. In 2006, he was named one of the UK's pioneers of science for his research into cot death. His work has saved the lives of an estimated 100,000 babies worldwide.
The work we've been doing in Bristol, which has really been going on for over 30 years now, has focused on trying to understand the circumstances that might make babies at risk of dying suddenly, and learning how to make recommendations about care of babies that reduces the risk of things going wrong. We've managed to reduce the numbers of babies dying suddenly and unexpectedly, locally and indeed nationally and internationally, by about 80%.
Professor Fleming's research owes much to the Bristol City region.
The Bristol area, it's almost unique. It matches the UK in terms of income, population distribution, unemployment rates, urban-rural mix, and many of the factors which affect the quality and indeed the things that affect people's health and illness are reproduced in Bristol.
Over in Bath, at the Centre for Regenerative Medicine, Dr. Melanie Wellham is beginning another day of stem cell research. She's hoping to find new treatments for some of the most debilitating diseases of our time.
The reason that we're very interested in stem cells is because they have the capacity to change into many other cell types. And that's very exciting from a biomedical point of view, because lots of diseases that we think about that affect many people, like neurodegenerative diseases such as Parkinson's and Alzheimer's disease, arise because cells in the brain actually deteriorate and the numbers reduce, and that's what leads to the symptoms of the disease.
If successful, Dr. Wellham and her team will help to develop a whole new approach to medicine.
Typically you go to your doctor and you're prescribed a medication, it's a small molecule, it's a chemical essentially. What we're talking about is actually using cells to treat patients, so it's a huge difference to what you would traditionally do. But I think that these cell-based therapies really offer the possibility to actually cure patients rather than patients having to continually take drugs for their entire lifetime. So that's why it's very exciting and new.
It's the morning rush hour. The city's roads are filled with traffic as everyone heads to work. Martin Lowson is passionate about public transport. He envisages a future in which each of us will be able to command a driverless and electric eco-taxi.
We started off with an analysis of what people really wanted out of public transport. They want something which goes when they want, takes them where they want to go, without stopping. And obviously neither cars nor buses really do that. One of the objectives in any modern transport system is to make it sustainable. We can save carbon over a factor of 3 over a car and a factor of probably 2 over a bus. So it is genuinely sustainable, we believe.
Martin Lowson's sustainable transport system may be Bristol's update to Brunel's railway.
I came to Bristol because I thought it was a great city, and I must say I like it. In fact, I live right by the suspension bridge, so I see some fantastic engineering every day.